Chronic conditions require patient self-management, and in fact, most of the ongoing care for chronic diseases takes place outside of the doctor's office. It's in the hands of the patient. The patient makes choices about whether they're going to take their medications as prescribed, what they're going to eat, whether they're going to exercise that day. And so we know that self-management is hard. When a patient who has diabetes or hypertension, chronic kidney disease, or any other condition is struggling with self-management, then their providers need to be able to offer them a solution, something that works, something that helps them through the self-management process. And DECIDE is that solution. DECIDE is a patient self-management training curriculum that's based on problem solving as an evidence-based approach for helping people with behavior change and behavior maintenance. Most people have any number of competing priorities. They may have multiple demands for their time, their attention, their resources, their energy, their family issues, there's work, and that's where the problem comes up. So DECIDE is a program that's designed to help people identify and manage those barriers and challenges to care via this self-management training approach. In this program, there is a 9-module curriculum that includes the educational session and then 9 modules of problem-solving training. That's packaged as 2 workbooks, 2 patient workbooks. In addition to the workbooks for the patients, the provider or the interventionist who's delivering the program to a patient receives a training manual that walks that trainer step by step through each of those educational and training modules for the patient. We have a health problem-solving scale that we developed in order to help identify and characterize how people currently apply problem solving to managing their health. We also have a DVD of an educational video. So we developed this educational video called Decide to Move, and the video itself has real patients demonstrating their real stories, their real efforts at engaging in physical activity. And importantly, it presents physical activity as not only structured exercise, but the types of activities people do in everyday life. What counts? How much of it counts? What can you do in your daily routine that's going to help you hit those clinical targets? We've had now over 10 years of development and testing of DECIDE. We've now had several randomized controlled clinical trials that have been conducted to test effectiveness of DECIDE and to fine-tune it to meet patients right where they are.